Linda Shaw Miller wrote into me, very concerned about getting scammed. She said she signed up for the new registry at UPMC and then said she started getting text messages asking her to click on a link to give some of her health information, and she's worried that it may not be legitimate. And so, not even just focusing on UPMC's registry, but bigger picture here, what do people need to be wary of when signing up for vaccine registries?
So the idea behind the registry is that we can get people on a list so that as vaccine supplies become available, they can be contacted and know where to go to get vaccinated. Part of that is going to be collecting your health history, because anybody who is providing vaccines needs to be able to put you into one of the 4 categories that the state has for vaccination priority. I don't know enough about the specific registry at UPMC, and I certainly don't know about the text messages that this viewer received. And there is a balance, but I would suggest that you contact whoever sent you the text, or to contact UPMC to make sure that it's legitimate. But collecting health information is going to be part of this process.
All right, good to know. And final question today comes from Emily. She said she has been hearing about research indicating that people who had COVID maybe only need 1 shot to have full immunity. And she actually wanted to know if there was any research looking into whether people who had COVID need immunized at all.
This is really an area of emerging data where we don't have a full picture. But what we understand, first of all, is that those who have had COVID have had a very variable immune response. So we don't know for sure whether that is enough to fight off future exposure to the virus. What we are seeing now is that there may be enough of an immune response if you've been sick that a single dose of vaccine may be acting like a booster to give you a consistent response to being confronted with the virus again. This is all very new science, and the FDA is looking at it, but I would not be surprised if in the near future we learn that those who have had a COVID infection in the past only need 1 dose of the 2-dose vaccines, Pfizer and Moderna.
And we want to take your questions to Dr. Vinkit. You can send a message to my Facebook page or the WTAE Facebook page, and we will work to get you answers. I'm Kelly Sasso, Pittsburgh's Action News 4.